Have you been forgetting words more often than usual, struggling to concentrate, or suddenly feeling off balance without a clear reason? This video explores a little-known cause behind these symptoms: silent strokes. Many people assume a stroke always comes with dramatic warning signs. They think of slurred speech, numbness, or sudden paralysis, and they believe they would know if they had one. But here's the surprising truth. Not all strokes announce themselves. Some happen quietly, with no pain, no collapse, no 911 call. These are called silent strokes, and over time they can do real damage to your memory, focus, and overall brain health. Neurologists now believe that millions of older adults have experienced a silent stroke without realizing it. According to the American Stroke Association, more than one-third of people over age 70 show signs of silent brain infarcts, small areas of damaged tissue in the brain found on imaging, often with no clear symptoms at the time. In this video, you'll learn what a silent stroke actually is, the subtle warning signs that often go unnoticed, how silent strokes affect memory and thinking, what tests can detect them, and how to reduce your risk moving forward. Let's begin. So, what exactly is a silent stroke? Well, a silent stroke, or, silent cerebral infarction, happens when blood flow to a small part of the brain is briefly blocked. This blockage stops oxygen and nutrients from reaching that brain tissue, which unfortunately causes that area to die off. But since the affected area is usually pretty small and not connected to things like speech or movement, the stroke might actually occur without any obvious symptoms. That's actually why it's called silent, but just to be clear, silent doesn't mean harmless. It just means the signs are really easy to miss. These strokes are often only discovered later on, during an MRI or CT scan, usually when doctors are looking into memory loss, confusion, or maybe some other neurological concern. Even a single silent stroke can damage important brain areas. But what's especially worrying is that a lot of people have more than one silent stroke over time, and that can slowly chip away at cognitive function. So it's helpful to understand the difference between a silent stroke and a typical stroke. A major stroke affects larger blood vessels and often results in dramatic, sudden symptoms like slurred speech, facial drooping, weakness on one side, or difficulty walking. In contrast, silent strokes tend to occur in the smaller blood vessels deep within the brain. They don't usually affect motor function or speech. Instead, they often target areas linked to memory, focus, or decision-making. That's why the aftermath may look more like brain fog or forgetfulness, not a medical emergency. But repeated silent strokes over time can lead to what doctors call vascular cognitive impairment, a condition that resembles dementia. So while they may be silent, their long-term consequences are not. Because the symptoms are subtle, they're often dismissed as just aging. But there are some clues to watch for, especially if they come on suddenly or without explanation. These include sudden difficulty concentrating, brief confusion or disorientation, trouble finding the right words, feeling off balance or dizzy for no clear reason, sudden vision changes, like blurriness or tunnel vision, weakness in a limb that fades quickly, episodes of numbness or tingling that come and go, and feeling mentally foggy or emotionally flat. Individually, these may not raise concern, but if several appear together or repeat over time, it's worth speaking to a doctor, especially if you've had risk factors like high blood pressure, diabetes, smoking, or, a history of stroke in the family. Memory is one of the most commonly affected areas. That's because many silent strokes occur in the deep parts of the brain involved in information processing, short-term memory, and attention. When blood supply is cut off, even briefly, neurons in these regions can die. The result? Difficulty recalling recent events, slower thinking, losing your train of thought during a conversation, or sometimes feeling like your brain takes longer to warm up each morning. These symptoms can look like early dementia, but, they may actually be the aftermath of vascular damage. A 2008 study in the journal Neurology found that older adults with silent strokes performed worse on memory and executive function tests, even when they felt fine day to day. This tells us that silent strokes don't just affect the body, they change how the brain works. And honestly, the earlier we recognize them, the better our chances of preserving mental clarity. So, who's most at risk? Well, certain people are more likely to have a silent stroke, especially those with some specific health conditions. High blood pressure is the #1 risk factor. Then there's type 2 diabetes, high cholesterol, heart disease, or atrial fibrillation, a history of smoking, a past stroke or mini-stroke, which is also called a TIA, and obesity or a sedentary lifestyle. Age is also a factor. The risk really increases significantly after 60. But here's what's important. Many of these risk factors can be managed, and the brain, even in later life, has the ability to rewire and recover when given the right support. Because they don't cause dramatic symptoms, silent strokes are often found by accident. Many people only discover them during a brain scan for something else, like memory loss or dizziness. The two main tools doctors use are MRI, which stands for magnetic resonance imaging, and CT scan, or computed tomography. MRIs are more sensitive and can detect smaller areas of damage that may not appear on a CT scan. These scans reveal tiny lesions, small dark spots in the white matter of the brain, indicating past oxygen loss. Your doctor may order one of these tests if you've had recent cognitive changes, unexplained neurological symptoms, or if you have risk factors for stroke. It's also important to have a full evaluation that includes. So let's talk about some of the key tests and reviews you might encounter. These include blood pressure and cholesterol checks, blood sugar testing, and heart rhythm monitoring, which helps to detect atrial fibrillation. And of course, there's also a review of your lifestyle and any medications you might be taking. A diagnosis isn't about creating fear. Instead, it's really about gaining clarity and opening the door to prevention. Can you recover from a silent stroke? Well, the brain is incredibly adaptable. Even when certain cells are damaged, other parts of the brain can sometimes take over their function, a process called neuroplasticity. But this requires the right environment: oxygen-rich blood flow, reduced inflammation, mental stimulation, and, consistent healthy habits. If you've had a silent stroke, you might not notice changes right away, but without proper care, future strokes, silent or major, become more likely. That's why recovery isn't just about what happened in the past. It's about protecting your future brain. Many people who've experienced silent strokes go on to live full, mentally active lives. The key is to treat it seriously, even if it didn't feel like a stroke at the time. So what can you do to protect your brain now? Well, prevention is powerful. Here are science-backed ways to lower your risk of silent strokes and preserve your memory. First, control your blood pressure. Aim for a target around 120/80, unless your doctor advises otherwise. If you have diabetes or prediabetes, it's really important to keep your levels stable with diet, movement, and, medications if needed. Daily walking, a bit of light stretching, or even dancing can improve circulation and help reduce your stroke risk. Smoking damages blood vessels and honestly accelerates brain aging. Eat brain-friendly foods. Think leafy greens, berries, olive oil, fish, nuts, and whole grains. The Mediterranean diet is particularly effective in protecting the brain. Stimulate your mind. Read, learn, solve puzzles, socialize, teach others. Every time you challenge your brain, you strengthen your mental reserve. Sleep well. Aim for 7 to 8 hours of sleep each night. Poor sleep is linked to both stroke risk and memory decline. These steps may seem simple, but honestly, they are powerful. Because brain health isn't built in a day. It's protected, one small habit at a time. When to see a doctor? You don't need to panic at every moment of forgetfulness. But there are times when it's wise to talk to your doctor. Make an appointment if you experience sudden memory lapses that don't improve, difficulty concentrating that affects daily tasks, episodes of confusion or disorientation, weakness, numbness, or dizziness that comes and goes, or changes in balance or vision without explanation. It's also a good idea to speak up if you feel different, even if you can't fully explain it. Silent strokes may be invisible on the outside, but they leave a trace. And the sooner you know, the better your chances of protecting your mind in the long run. It's easy to brush off changes in memory or attention as just getting older, but sometimes the cause is deeper and more preventable than we realize. So, silent strokes are not rare, but, they are manageable and they really don't have to define your future. Your brain is still capable of growing, healing, and adapting, even after 60, 70, or 80. What matters most is awareness, knowing the signs, and choosing one day at a time to care for the most important organ in your body, your brain. Thank you for watching Silver Memory. If you found this helpful, consider subscribing for weekly, calm, and trusted insights about memory, aging, and brain health. You're not alone, and your mind is worth protecting.